What you see there in this video is a classic example of late presentation of rabies. But what is rabies and why should you care? Rabies is a viral infection caused by a virus called Rabies. It is spread by bites from infected animals like dogs. Typically, when the bite occurs at areas like the head and the neck, it is very fast. The symptoms are very fast, but if it occurs at the limbs, it's much more progressive. Now, the symptoms you saw in those videos are 100% preventable if you present early to the hospital. But if you get bitten by a dog, whether it's a vaccinated dog or an unvaccinated dog, what should you do? 1. Wash the wound thoroughly, like your life depends on it. Wash it with running water and with soap. That is the only first aid you can actually do. Then you bring the patient to the hospital, or come to the hospital yourself. In the hospital, you will be given two kinds of treatments. First of all, the wound around the region, if there's any wound, the dead tissues will be removed, and if there is any, it will be left unsutured. You'll be given anti-rabies immunoglobulin, and then you'll be given an anti-rabies vaccine, which is typically given in 5 courses: on the 0, on the 3, on the 7, on the 14, and on the 28th. Now, how are the symptoms of this presented? Initially, it has an incubation period of 10 days. The patient just first has a fever, normal fever, pain around the region, then numbness, and then it progresses to hallucinations, agitations, and then because of the virus has affinity, it likes the brain and the salivary gland, it now paralyzes the muscles of the throat. That means the person is unable to swallow, and that swallow is what makes the swallowing difficult, what makes them afraid of water. That's why when you give them water, they are afraid, they actually shake. Now, because of the paralysis of that muscle and they give up that sound as though it were barking, that's actually coughing. But because of that paralysis of the muscle of the throat, it gives off as though they were barking, but it's not like they want to bark. It's not as if because they were bitten by a dog, they are now bark like the dog. Now, this drew saliva. Why? Because of the virus also affects the salivary gland. That also. Now, once the symptom has gotten to that level, it is fatal. There is nothing you can actually do about it. So do not wait. If you get bitten by a dog, don't say my dog is vaccinated. No problem. Still report to the hospital, because there's a difference between being vaccinated and being immunized. That's a topic for another day. Now, if you've experienced any of this before, any of this symptom before, or you know someone that has experienced this symptom, or you've been bitten by a dog before, let me hear your comments. Let me hear your ideas in the comment section, and let's discuss about it. Like this video, share this video. You might be saving a life. I share these kinds of videos and much more about health topics without the medical jargons. Rabies is 100% preventable complication if you present early. Dr. JAJ. Peace.